But can I wish her all the best, an absolute stellar career, and I'm sure she'll contribute a lot in the border community, whatever she chooses to do post-tennis. But I'm sure everyone joins in congratulating Ash on everything she has achieved in her time in tennis, and how much she has given so much to the border community in her advocacy and encouraging young people as well. But I know she does a lot of community work, and hopefully we'll see even more of that happening in the future. I also want to note that, of course, today's COVID figures, we've got over 10,000 new cases reported in the last 24 hours. A large proportion of those, 7,090 of those, are rapid antigen tests. So thank you to people who are continuing to do those home tests and are continuing to isolate, and also their household members continuing to quarantine, because that will help us reduce the spread. We are seeing, of course, an increase, and it's been reported today, of COVID cases amongst children, and we talked about this yesterday, that with the variant of BA2, we are seeing that particularly primary school kids right up to people around 30 years old are the larger number who are getting this, because they're the more mobile in the community, and of course they're passing this on to other people. So again, I don't think I can say too many times that we need people to come out and get vaccinated. We need parents bringing their children out to get vaccinated, particularly the 5 to 11 year olds, but even our 12 to 15 year olds are not at the same rate as the border population. And also people who need their boosters. We know boosters make a difference with Omicron. So please, you might be perfectly healthy and think, no, I'm fine if I get some mild flu-like symptoms. But what about the loved one that you want to go visit in aged care or in hospital, or vulnerable people in your friends or family or neighbours or your friendship group that may be more at risk with COVID? Please. Think of them as well as yourself when it comes to making decisions around getting your booster and getting your children vaccinated. I also wanted to take this opportunity today to comment on the LNP who are out doing their roadshow again around health. And as much as the LNP want to run around talking up a crisis in health, can I say this, that the best thing that David Crisafulli and the LNP can do here in Queensland to help take pressure off the public health system is to back in every single health minister in this country who are calling on proper consideration of funding for health. And I don't mean just public health and hospitals in states. I mean listening to the AMA about increasing the number of medical students, places for training. I'm talking about further incentives to attract doctors to go into general practice, to attract and retain them in the regions and in remote communities, but also metropolitan and outer metropolitan areas, to commit for a proper review and increase in Medicare subsidies that go to GPs. Because the people that come into our emergency departments, we can do everything to invest in more beds, and I can proudly say today we have another 26 new beds coming on at the QE2 hospital in June this year. $12 million investment, 26 new beds on top of the investments we've already made in government and the investments we continue to make, including in the ambulance services with new stations, new ambulances and more paramedics. But simply cherry picking out of performance data and RTIs to try to make the system look worse than it is, and to ignore what is happening across this country, is either completely naive or deliberately seeking to mislead the community. Queensland is performing well compared to other states when it comes to our elective surgery and our performance data around ambulances. But of course there is pressure. And I've seen the comments this morning from Ros Bates and David Crisafulli around that there were problems before the borders opened. COVID has been around since the start of 2020, and it's about time David Crisafulli acknowledged that. Now with the practices we have around COVID, it takes additional time for every single ambulance that attends someone's premises and then transports those individuals, both in the PPE that they need to wear, the cleaning down of ambulances, the processes they have to go through, as well as the increased time in every single one of our hospitals, in every person who walks into an emergency department or gets admitted to a hospital. And many are testing positive, and how we have to manage those people. People who are coming in for appendicitis, who are testing positive, who didn't realise that they had COVID. Many people coming in for other conditions who are also showing up positive that we have to manage in the health system. All of these things are on top of the ever-increasing demand on our health system that every single health minister in this country is talking about. And in the lead up to a federal election, I know we're going to see Scott Morrison running around Queensland announcing buckets of money for individual hospitals and facilities. I welcome that. Any money that Scott Morrison and the LNP federally want to spend in the health system, great. But what about the broader long-term reform of the health system? What about lifting the cap on health funding? What about increasing funding to make it true 50-50? And how about looking after primary and allied healthcare, which they are fully responsible for, and NDIS and aged care, which we will know make a significant difference in the pressures on our health system. Questions?
The union is also talking about the pressures on the health system and about ambulances at the moment. They say that there was an improvement in ambulance ramping, but we're now seeing over the last few weeks we're going back to where we were last year. Do you agree with the union?
Yeah, and look, I had a meeting with my my department about this again yesterday. Every week I'm seeing the data as far as how we are going with patient off stretcher time at our hospitals. We've seen some really good improvements in areas like the Gold Coast, but in other areas we are still seeing major demand pressures. Despite some of the initiatives we've put in, the transfer initiative, nurses in our emergency departments, the paramedics we're putting on our ramps, the triage facilities that we're popping up at Logan and Gold Coast and other facilities. So some of these have seen an improvement, but is it where we want to be? No, we need a lot more work. And we know it's not just about paramedics. It is about opening up beds. It's also about making sure that we are improving what we're doing with the facilities we've already got. So how do we utilise the equipment and the staff that we've already got? But the issues on fatigue. Our staff are exhausted. Every hospital and health service right now is working on a fatigue policy of how we support our staff to take leave, because it has been a very tough 2 years for our paramedics, our operational staff, our call centre staff, and our health workers in our hospitals, who have been running also hotel quarantine, vaccination and testing clinics. And we need to make sure they've got a break, but we also need to make sure that we can backfill these people. And there's a shortage of health workers across the country right now.
We're hearing
about it, are you, in the lead up to flu season?
Look, we are concerned. Sadly, with the increase in COVID cases, we talked about yesterday, we're not seeing an increase in ICU, which is great news, and we're not seeing a significant increase in beds with COVID. However, what I have seen in the last few days is an increase in health workers having to be isolated and quarantined again. That does concern me, because even though we're not seeing more COVID patients, we've got now less health workers to manage the patients that we have got. And on any given day, a doctor, a surgeon is calling in saying, I've just tested positive. Surgeries are having to be suspended because of that. Nurses unavailable, physiotherapists, allied health professionals. So it is still having an impact. The figures I saw yesterday, we've got over 1,600 health workers again now actually in quarantine or isolation.
So are you discussing any tightening of rules, like bringing back the mask mandate?
Look, not at the moment. We've already got a lot of those rules in place, in our hospitals. We've still got the mandatory vaccination in place. So we'll continue to monitor this really closely. As I say, we're not seeing an increase in beds, but we are seeing an increase in the people who have to quarantine and who have to isolate. I know these things are being considered by AHPPC currently. We'll await advice from them as to whether they believe that there's more measures need to be taken around this new variant and what the impact's going to be. It's too early again to know. But it is certainly having an impact on the number of people who are having to stay home. And I know that's going to have the impact not just on health, but business generally. Again, staff being furloughed.
Just on that, I think National Cabinet agreed earlier this month to transition away from all types of quarantine. Is that something that you're concerned about in light of this new sub-variant? Is this something that the Queensland government's concerned about?
Look, we're watching this very closely. We're not surprised. We said there'd be further waves. We knew that the big wave we had, we managed to avoid a Delta wave, which meant we saved thousands of lives. But we knew that the wave we had in December, January and February was not going to be the only one. We hope future waves are going to be less, and we're still seeing less of an increase than what we hit in our peak in January. But we're watching very closely what this means, and we will take AHPPC's advice. It is AHPPC that's been asked by National Cabinet to look at the quarantine rules. So this is for close contacts, not about people who are positive. And I have no doubt they will be considering that in light of what we're seeing with increased cases again. And I can only emphasise that, yes, in winter, we are likely to see more cases, and we will see flu. And we will see many flu cases coming back because of international arrivals again. And I can only emphasise again the need to get vaccinated for COVID, and when the time comes, when the flu shots are available, making sure people get their flu shot this year as well.
Have you spoken to the CHO about that transition away from quarantining rules, and what advice has he given?
Well, he sits on AHPPC, and I'm awaiting any information and advice that they're going to have back for us. I know they're having those conversations at the moment.
What about the fourth booster? I mean, most people haven't even got their third booster.
Yeah, look, TARGI has not recommended a fourth booster at this stage. So before we worry about talking about a fourth booster, the fourth vaccine is only for those who have severe autoimmune conditions and are being recommended by their doctors and their treating physicians. For everyone else, it is 3 shots. And that's what we're asking people to get. So we don't have to worry about a fourth booster at the moment. It's not recommended. If it is, then we will deal with that at that time. But right now, we know it is recommended people should be having 3 shots. We know the difference between that second vaccination and a booster. We've seen the difference in our hospitalisations, and we've seen the difference in our aged care deaths as well. And we know that it can help save lives and reduce serious illness. So I can't emphasise enough that people need to be getting their boosters.
Are you getting any data on people catching COVID twice?
So we know it can happen, especially if you have had one of the previous variants. So, if you had COVID in 2020 or 2021, you should not be surprised if you get COVID again, and you should certainly not be assuming you can't get COVID again. In fact, I've just come out of isolation, and I've read the website, and it says that if I was to test positive again after 4 weeks after coming out of isolation, I should assume I've got COVID again. And I would need to go back into isolation. And we don't know yet whether you can get this new variant, the BA2, after having already had Omicron. So everyone should assume that can happen. And if you have had COVID in recent months or in the past couple of years, and you start getting flu-like symptoms, you should still be testing yourself. Either take a rapid antigen test or go get a PCR test.
I've seen reports about ambulance paramedics falling sick at their desk, also being so concerned about their fatigue levels they haven't been able to drive home after their shift's ending. The union says a lot of the shifts are also having to be pushed out. On a workplace health and safety level, are you worried about that?
Look, we've got a really strong workplace health and safety policy across Queensland Ambulance Service. They do have a fatigue policy. I understand the right to information that was released. It's over 900 pages, and there is not hundreds of cases of those. They're very, very isolated cases, and that individual did register their fatigue, and it was handled well. I've seen accusations and claims in today's media that staff are being asked to use their own vehicles to treat patients. That is just not accurate. That is absolutely refuted by Queensland Ambulance Service. If a operational staff needs to use their own vehicle, it's when they are being asked to attend at a different station, and so to transfer to another station or work at another station, they may use their own vehicle to get there. But as far as attending to patients with their own vehicles, I'm not aware of any examples of that. But fatigue is a concern. And not just with our paramedics, with our health workers. I am very concerned how exhausted our health workers are, and that's why our hospital and health services are working on a leave policy to deal with the fatigue of our health workers and how we're going to backfill when there is a shortage across this country of health workers right now, because we haven't been able to get overseas workers, which every state gets overseas workers coming in and supplementing our core workforce, and we haven't been able to do that for 2 years.
We've just received a media release about 26 new beds for QE2. Is that an old announcement?
No, not at all. The beds will open in June, so I'm really pleased that we're able to open another 26 new beds, a new ward, medical ward, at the QE2 hospital. We've got over 1,000 beds coming online between now and 2026. We are building new hospitals, new mental health facilities, drug and alcohol facilities. So we continue to invest. We have a very big pipeline of projects that are commencing construction this year and future planning. But we can't control what comes in the door. We can only manage what is coming in. We can't control the volume of what's coming in. And that's why, you know, the 600 beds of people who should be in aged care and on disability packages in the community, you know, that's something that the Morrison government could be helping with. GPs are crying out for an increase in the Medicare subsidy. You know, it's really hard to get young doctors coming out of medical school wanting to become GPs because it's just not financially viable, and it's even harder to attract them into the regions. Even in my community, you try to get a bulk billing doctor, many have closed their books. Many GPs have closed their books. It's very hard to go see a GP. And if you need to see a GP now and you're being told, sorry, we can't get you in till Friday or till next week or later, where are you going to go? You're going to go to an emergency department.
Are these the same 26 beds that were announced on the 11th of May 2021 for QE2 Hospital?
Well, when I say it is new beds coming online, it is absolutely new beds coming online. So, you know, we are announcing that these beds are going to be open. And in June, because I know that Chris Foley has said today, oh, well, QE2, they've got problems, where's the beds? Yeah, the LNP...
So are these in addition to that announcement?
No, this is the announcement. What I'm announcing is these beds are opening in June. They are on time, within budget, and we are announcing 26 beds coming online in June. And, you know, I'm a bit fed up with David Christopherly running around all these states saying that we're not investing in staff and beds. I will hold up the Palaszczuk government's record on investing in staff. You know, over 9,400 new staff in one single term, frontline staff we're putting on. Extra paramedics, over 200 since June last year alone. When the opposition talks about investing in beds and staff, they have no credibility in this space. We have a long pipeline of work. We've got, you know, runs on the board of what we've done since we came into government in 2015. There are many new facilities I've opened just in the 12 months as Health Minister, and many new ones that are going to be opening, as well as 1,000 more beds between now and 2026.
Okay, thanks guys.
Thank you. Thanks for coming to Redcliffe.
Beautiful. A little windy.